Good morning, everyone. Today's lecture topic is FACEBOW and Articulators. I'm Dr. Priyanka. So, coming to the learning outcome, you'll be able to define FACEBOW, describe the basic parts and importance of a FACEBOW, discuss and recognize the importance of compensatory curves towards the end of the lecture. So, coming to the definition of a FACEBOW is a caliper-like device that is used to record the relationship of the jaws to the opening axis of the jaw and to orient the cast in the same relationship to the opening axis of an articulator. So it's basically recording. It's a caliper-like device which records the relationship of the jaws from the base of the skull. So coming to the orientation relations. So by using a FACEBOW, we are recording the orientation jaw relation. It's the same. It's the orientation relation. So the definition says to orient the mandible to the cranium in such a way that the mandible is kept in its most posterior position. The mandible can rotate in a sagittal plane around the imaginary transverse axis, passing through or near the condyles. So, sagittal plane here means when the mandible moves downwards and forwards. So, it is the relation in the plane, in the sagittal plane. Coming to the orientation of occlusal plane. So occlusal plane, you can see this is an occlusal rim. This is in the patient's mouth. So occlusal plane is defined as the average plane established by the incisal and occlusal surfaces of the teeth. So you can appreciate that the interpupillary line is there, the chamfer's line, and the occlusal plane. So all of these. Coming to the importance of the orientation of occlusal plane. So anteriorly, occlusal plane mainly helps in achieving aesthetics and phonetics. Posteriorly, when there are muscles which come into play, which is the tongue and the buccinator muscle, it helps to position the bolus of the food and holds it during the mastication. So incorrect occlusal plane hampers the aesthetic, phonetics, and mastication. It may affect the stability of the denture and it that may create a resorption in the. So the functions. Uh, the functions of a FACEBOW, it establishes the relationship between the maxillary arch and the horizontal plane. It also transfers we can also transfer this relationship to an articulator, so it helps in the transfer, and it also provides an accurate mounting of the maxillary cast to the articulator, right? So you can see that this is the way we place a FACEBOW on a person, and that is what relationship we are trying to record exactly. So these are the various parts of the FACEBOW which we are discussing in the next slide. Okay, so the parts of the FACEBOW is the U-shaped frame, the condylar rods, the bite fork, the occlusal rim, the maxillary occlusal rim. You are usually using only the maxillary occlusal rim, and the locking clamp or a device, and orbital pointer. This is the third point of reference. So coming to the arbitrary FACEBOW, we can make use of this and have an approximate point on the face as a posterior point of reference. The condylar rods are positioned in these points. So you can see that these are the condylar rods which are used, and this is the third point of reference or the posterior reference point. Sufficient for the fabrication of a complete denture, fixed, partial, and removable partial denture. There are a small error in location while using an arbitrary FACEBOW, which has a negligible effect on the occlusal plane. The fifth point is the resiliency and the lifelike effect of the oral tissues make the exact transfer and the location of the hinge axis unnecessary. So these are not really required in, the face bow. Yeah. Okay, coming to the types of the arbitrary face bow, that's the fascia type and the earpiece type. The earpiece face bow is converted to the fascia bow simply by removing the earplugs. So you can just remove the earplug and make it a fascia bow, fascia type. It utilizes the posterior reference point on the skin over the TMJ region, which is this portion. Makes use of the condylar rods instead of the ear inserts. So you can use the condylar rods, which is the vertical rod you see instead of an earpiece which goes inside. In the earpiece type, it uses the external auditory meatus, which has fixed relationship to the hinge axis as the arbitrary posterior point. So this ear bow is attached inside. Each earpiece has a central hole that connects to the auditory pin on the articulator. Also, it does not require measurements or marks on the face, and the accuracy is similar to the arbitrary method. Coming to the kinematic type, so an example is here. It is used to locate and transfer the true hinge axis. Complex instrument requiring the fabrication of clutches which are attached to the lower jaws. It requires more chair time procedure. It also requires the use of articulators with extendable condylar shafts. So these extendable condylar shafts, example is a Hanau H2X, which must be extended to meet the stylus of the FACEBOW. Okay, so this is about the kinematic FACEBOW. So you can see this is an example and it has an extension attached. So it can mimic the hinge axis, the true hinge axis. Okay, and the hinge axis is just the axis where the mandible does the opening and closing. So it's basically the closing and the opening movement. Okay, so coming to the conclusion for the FACEBOW topic. So blind orientation will result in errors. The elimination of errors that can be produced by failure to use a FACEBOW where indicated. By failure of using a FACEBOW justifies the time required and the procedures involved in the FACEBOW transfers. So basically, this is used to eliminate the errors and the accuracy and the time required is also the accuracy is proper and the time required is less than doing a normal orientation position. So, usually in our clinical step in a complete denture, we are orienting the maxillary rim through the elatragal line. So, we are also doing it, we are also doing orientation jaw relation, but we are doing it without the face bow. So, we also do it. So, just explaining the definition into an easier way. So, the articulator basically simulates the TMJ, right? So, basically, a person, like a face of a person with a TMJ. I mean, you can just think about it like that. Not a face, but it's basically a joint which open, closes, and does some lateral and protrusive movements. So coming to the uses, so it has a diagnostic purpose to diagnose or analyze the dental occlusal condition in both natural and artificial dentition, to plan the dental procedures, to aid in the fabrication of dental restoration and appliances, to correct and modify completed restorations, for patient education, to arrange artificial teeth. So it has multiple uses and it is very useful in treatment planning and fabrication of our prosthesis. So coming to the requirements, it should open and close in a hinge-like fashion. Hinge-like fashion means basically open and closing of the mouth. So it actually opens and closes, yeah. It should hold the cast in the correct horizontal and vertical relation. So once we get the relation, we should be able to mount it in the exact measurement and a location how it is placed in the mouth. It should simulate the protrusive and the lateral movement. So the forward and the lateral left to right movements can also be, simulated. The moving part should be accurately machined and move freely and accurately. The non-moving part should be rigid in construction. It should accept the FACEBOW transfer. Coming to the additional requirements, adjustable horizontal and lateral guide elements should be present or may be present. So, sorry, it may or may not be present. So, there we will see in some articulators it's there and some it's not there. So, it can have a condylar element on the lower frame and the condylar guide as part of the upper frame. This also there may be present or may not be present. If these things are present, it'll give more accuracy. It should have a mechanism to accept the third reference point during FACEBOW transfers. So FACEBOW transfer may not be possible, and the third reference point mark is also present. So it's a form of a metal part. A terminal hinge position lock is there. So again, can or cannot be there, may or may not be there. Removable mounting plates that can be repositioned accurately. These plates, you mount it and then you can just take out that cast and mount another one. So you don't have to like break it in, our normal articulators. So you can just like screw and unscrew it. In that case, the upper and lower cast can, you can exchange it with another patient or the same patient's another cast. An adjustable incisal guide table. So the incisal guide table we can have some angulation, and this will respond to the protrusive and lateral movements in the patient's mouth. So it can be done if required. Adjustable intercondylar width of the condylar element. So the intercondylar width can also be, adjustable at few angles. So basically, these things are present in a Hanau series articulator, which we'll read about in the next slides. Okay, so coming to the advantages, there are better visualization of the cast and restoration and occlusion, especially from the lingual side. So yes, we can. This is an excellent point. Whenever you all come and show me the work, I have to see the lingual side of the occlusion, which is a little difficult to see in the patient's mouth. So that's how we can appreciate this device immensely. Okay. Coming to the chair side and patient appointment time, which is reduced. Patient cooperation is not required because this is not in a patient's mouth. And saliva, tongue, and cheek hindrances also is eliminated. The real effect is eliminated. So the lifelike structures or resiliency in the tissues are also eliminated and not required. More procedures can be delegated to the technician. So this procedure can be also done by the technician. So this is like a lab procedure. When you use an articulator, you do mounting and then you do teeth setting. So it can be given to a technician with the correct measurements, as we have already taken the orientation jaw relation and the vertical relation and done the centric, and then we have proceeded for articulation. So coming to the limitations, since it is mechanical instrument, it is subjected to errors resulting in fatigue and wear. It can simulate but not duplicate the jaw movement. Yes, so the simulation and duplication are two different things. So yes, we are just trying to simulate the jaw. Coming to the classification of the articulators, the classification is articulators based on instrument function. It is most accurate and widely accepted. So, from the International Prosthodontic Workshop on Complete Denture Occlusion at University of Michigan in 1972, this classification was established. It was established as Class 1, Class 2, Type A, Type B, Type C, Class 3, Type A and Type B, Class 4, Type A and B. Okay, coming to the simple hinge articulator. So you can see an example here. These are the simplest of the articulators. It actually just mimics the hinge movement or a hinge axis. So it basically does the opening and closing movements. That's all. So it's a simple holding device for the upper and lower cast. So it just holds the upper and lower cast as it is. And what is not recommended is the simple static occlusion. Coming to the mean value articulator. Okay, so this is a little advanced mean value articulator. And so this is capable of the lateral and protrusive movements in addition to hinge movement. So hinge movement is the opening and closing. Lateral movements is the left and right excursions. Protrusive is the front and back, a little bit movement there. So movements based on the fixed average value. Okay, we will be seeing what is the average value in the next slide. Dentures produced will have a static centric occlusion. So they will have an opening closing points all over the contacts on the upper and the lower denture, which is the which is a static occlusion. So when it's in centric, it's known as a static centric occlusion. Correction of lateral and protrusive interferences can be done on this articulator, but it would not be fully accurate in most patients. Further correction could be required in the mouth. So it's not the most accurate articulator, but yes, there can be errors and it can be corrected in the patient's mouth. So cast mounted on an average in an average position, the average value. Okay, so as you can appreciate that this is the this is the ball this is the sorry a Bonville's triangle. Sorry, yes, it says in the slide this is the Bonville's triangle. So the Bonville's triangle basically is the line joining the midpoint of the mandibular condyle and the incisor point. Okay, so this is basically the Bonville's triangle. Okay, the lower shaded triangle is the Ball-Wills triangle. Okay, so that is formed between the imaginary occlusal plane, occlusal plane and the imaginary plane of the Bonville triangle. Okay, so this forms an angle which is present here. You can see the angle here. That angle basically is the average value. Okay, so we usually mount in that average value in a Hanau articulator. Okay, and you can appreciate that the same triangle has been copied and simulated in the articulators. Okay, coming to the semi-adjustable articulator. So it has an adjustable condylar and incisal guides. It accepts a FACEBOW record. Also, it is of two types, the Archon type and the non-Archon type. The Archon type, so the term was coined by brainstorm. So archon, that means articulator and condyle. This term indicates an instrument that has its condylar element on the lower member and the condylar guide on the upper member. Okay, so that is the condylar articulator. It can also be known as the condylar articulators. Okay, so advantages is that it helps us in the better visualization and understanding of the mandibular movements. Example is the Hanna wide view articulator. Okay, so the non-archon type is the opposite of the archon type. The condylar element is in the upper member and condylar guide is in the lower member. Okay, so example is the Hanaus here. So you can see that the condylar element is in the upper member. Okay, and the condylar guide is in the lower member. Okay, so the opposite of that is the archon one. So this is an example as well of the non-archon types, and these are the whip mix models. This is a type of a non-archon articulator. Okay, so same thing, just explaining it into condylar form of an mandible. So semi-adjustable articulator basically are two types like we discussed. So the condylar element is in the lower member, which is here, and the mechanical fossa are placed on the upper member. Okay. In the non-archon type, the condylar parts stimulating the glenoid fossa are attached to the lower member. So basically, the condylar path is in the lower member, and the condylar element are placed on the upper portion. Okay. So this is the basic difference. And of course, in the photo, you can see the mandible, the glenoid fossa, and the condyle. So that's how they try to mimic or simulate those areas. Okay, coming to the lower member, which is an L shape with horizontal and vertical arm. Horizontal arm contains mounting rings and incisal guide table. So, and the vertical arm contains the posterior reference point and condylar analog. So, basically the auditory pin and the condylar analog. Okay, that's for the lower member. The mounting plate is the third part, so it connects the cast to the articulator. It can be detached from the articulator. Also, condylar analog is there, which represents the condyle. It is a spherical, the golden shape a structure attached to the lower member. Okay, condylar guidance. So this whole thing is a condylar guidance. So you can see that you can go from 0 to 50 and minus 10 as well. Okay, attached to the upper member. This is attached to the upper member and represents the slope of the articular eminence in the skull. So they slope in such a manner that we can do the excursion movements. Yes, we can do the protrusive and the lateral movements. Can be adjusted according to the protrusive interocclusal record obtained from the patient. Okay, coming to the incisal guide pin, it represents the vertical dimension of occlusion, rests on the incisal table and can be moved along its surface, can be raised or lowered to increase or decrease the vertical dimension. That is the long silver pin. Incisal guide table is a small round silver table where the incisal pin rests on. So it represents the lingual slope of the maxillary anterior teeth. So anterior guidance or mandibular movement can be established here. And there are two components to that. That is the anterior posterior component, the lingual slopes of the upper anterior teeth, and the lateral component. That's the palatal slopes of the maxillary canines, buccal cusp of the maxillary posterior teeth. Okay, coming to the fully adjustable articulator. So adjustable to follow the mandibular movements in all the directions. Condylar path and incisal guidance can be customized in such patients at a selected angle, right? And it can be molded by the acrylic resin. Okay, so you can see how we can attach the face bow to a fully adjustable articulator, and it can be transferred to the actual body of the articulator. So coming to the uses in gynecologic studies, which basically is like the TMJ studies, anything related to the TMJ. Okay, occlusal rehabilitation through selective grinding of natural teeth also can be done and establish occlusal rehabilitation of a like a full mouth crown or restoration case. Okay, so the example is Stewart articulator and Denner D5A. Okay, so these are the example of the Stewart articulator, and this is the Denner D5A articulator. These are the fully adjustable articulators, which is rarely used. So usually in our further studies, if you master in prosthodontics, we usually use the semi-adjustable articulators. So the Hanau series articulator. For this, we learn how to program. So we usually use the two guidance, right? And then by these, we use these methods to basically program the articulator. Okay, so these were the methods. Okay. So we are done with the topic. If there are any questions, please let me know. You can come and see me on the prosto floor. I'm always there on floor number 20 and in the polyclinic. And other than that, yes, you can refer to the the standard textbooks. And so that's what we have learned today. So maybe you can just brainstorm what we have learned. So this is an arbitrary type of the earpiece face bow which we saw. Okay, this is a fully adjustable articulator, right? This is a Hanau series articulator, which is a semi-adjustable articulator, right? So it's just showing how how when it opens and closes, how it's kind of mimicking the condylar movement. Okay, so this was the condylar guidance, right? So hope you remember that, and thank you for patient listening.